When you look at just about everything that has to do with COVID, there's a unanimity of opinion in Canada. I mean, there are small groups of the population, even when you're talking about, 80% being on one side and 20% being on the other side. 20% is still a pretty big number in terms of absolute people, but there is a consensus on the country, across the country, that we need to be very, very cautious. And they look at the United States as an object lesson of a country that hasn't been cautious, and they're looking at what they're seeing in the United States and saying, whatever we do, we can't have that in this country. So that means controlling the borders, but it also means not exposing yourself by visiting the United States anytime soon. Canadians are watching the news. They're paying very close attention to every piece of information that they're getting, particularly from official sources. They're treating it almost like emergency broadcasts. And something that's been very consistent coming out of our healthcare professionals and the people who manage our healthcare system and our politicians is that we need to prepare ourselves for a second wave. So that message is getting through. One of the interesting things that we've seen in our surveys is that anxiety about COVID has been going up. And the reason that it's been going up is people are worried about getting out of this routine in which they're in their houses and they can control their exposure to the disease. If they go outside, they know that they no longer have that level of control, which is creating a sense of anxiety. So what that means is that there's large percentages of the population that are looking for a lot of cues in terms of the establishments they visit that suggest that these are places that are safe to go to. And the reason that they really need to see those cues is because what they're seeing in the United States suggests that there's a worse way to handle things. It's really interesting to look at the behavior science behind some of the things that people are doing. And what they regard masks as an opportunity to control things themselves. So one of the things that's really interesting in this is it's not that they just look at, for example, governments and businesses and institutions to make people safe, although that is an expectation. They also want to be empowered themselves to make themselves safe. And they feel that masks are a big part of that. In fact, in the past, masks probably signaled some form of danger. Now they signal some form of safety, because if you wear a mask, you're probably doing the other things that are required in order for you to be safe. One of the things that people seem to think is that there's might be huge regional disparities in terms of public opinion on COVID. There is some variation by regions, but not as much as there is variations between rural and urban/suburban areas. And people who are living in urban and suburban areas are more fearful and are more desirous of things like wearing masks or potentially closing down again than people who live in rural areas. So what this shows is that there's really no national approach to this that will be satisfactory to every single part of the country, and that more of a nuanced approach that really relates to the conditions that are occurring in specific part of the countries will probably be better received.